Well, 2020 presidential candidates clashed on their health care proposals during the last Democratic debate in Houston, but they did not mention during the debate how they would fight the opioid addiction crisis, which is, as you know, linked to tens of thousands of deaths every year now. So for more on this, we're going to turn to the Vice President for the Institute for Family, Community, and Opportunity at the Heritage Foundation and former Associate Director of the White House Office of National Drug Control Policy, Charmaine Yoest. Charmaine, the candidates may not have mentioned the opioid epidemic during the debate, but they have definitely put out a lot of proposals about how to tackle it on their campaign websites. They talk about it on the campaign trail. And one of the most controversial ones is one that's been put forward by Bernie Sanders and Elizabeth Warren, and it's this idea of endorsed supervised injection sites. And essentially what that means is they do not provide any drugs, but they do allow a safe space with medical personnel for addicts to come in and essentially get their fix. Am I stating that properly?
No, that's exactly right. And thank you very much for coming back to the issue, since it doesn't get as much attention in platforms like the debates. So this is an idea that's been kicking around for a while, and it's basically the fad diet of the drug policy arena. It's like all of us, you want the quick fix with issues like this, but opioids and drug addiction in general is such a complex, multifaceted issue. You're not going to normalize it by saying, hey, this is where you can do this safely, and imply that there is a safe way of using drugs to address addiction. What is the correct way of looking at this is, at the same time, the Trump administration just in the last couple of weeks announced an additional $1.8 billion in grant funding to go to state and local communities who are trying to address this at the local level. Look, addressing addiction is an intensive intervention with the person who's struggling, and it has to be done at the local level. You have to wrap them around with services and not look for the quick fix, but be in it for the long haul.
The flip side, of course, people who do support this, like Bernie Sanders and Elizabeth Warren, they say that it would save lives, and that they point to countries like Canada where at least Canadian officials believe that it has been effective. What's your response to that?
Again, the long term, what are we looking at? Are we looking for this safe one episode, or are you looking to help people long term stay safe, long term break the cycle of addiction and find a way to get back to a healthy life?
Another proposal that's being put forward, and this is proposed by Pete Buttigieg and Andrew Yang. They have put forward an idea of decriminalizing opioids, the idea behind that being that it would essentially eliminate some of the stigma that's tied to that, people who might be too afraid to come forward. And based on your smile, I think you oppose that too. Why?
Well, it's another old idea that just keeps circling around. The reason that we have the FDA that goes out and evaluates drugs is because some of them are not safe. And we do have to have a structure built around them so that people understand and they're able to interact with their doctors when they're taking a drug that has a very specific niche use for it. And opioids are a great gift to us in terms of the ability to use them to address pain when we need them in the right circumstances. You don't go out and just say, hey, you know, you can use this safely and under your own use, however you want to do it.
Before you go, I have to ask you about the uninsured rate in this country, because for the first time in nearly a decade, it has gone up, and Democrats are saying that it's because of the Trump administration's weakening of Obamacare or the Affordable Care Act.
Oh,
you don't think so?
Just the opposite is true, and they're seizing on this to try. It's a tiny, tiny, minuscule, less than 1% drop. What's really going on, the more important data that we're looking at, is the result of the Trump administration offering regulatory relief to states. There were 7 states that took advantage of the regulatory relief that was offered from the administration, and they're driving the first decrease in premiums that we've seen since Obamacare went into play.
Well, Charmaine, I know this is going to be talked about a ton in the coming months on the campaign trail. Thank you so much.
Thanks.
Charmaine, thanks. Leland?